Hello. Hello. I'm back at work. If you watched last week, you would know I was in San Francisco. My vacation felt long. Feels like 3 weeks since I've been at work, but it feels like less than a week ago since I recorded that video, so that's interesting. As thoughts go for being a therapist, I haven't been reflecting on a lot. I mean, I have, because I do that from as a therapist, here's my thoughts kind of thing. Not a ton. But one thing that I did reflect on, and I talked a bit about this last week with vacation and rest, is just the importance of, I really don't want to say work-life balance because it seems cliche a little bit, but work-life balance. Specifically, not making your life work, I think is important. I think it's very important. Specifically, I want to tie it into therapy because that's what I'm supposed to be doing. Therapist thoughts, not person thoughts. I think it's important for therapists to have better than average lives from a perspective of mental well-being. You know, a lot of people will say, I hear this as like a joke and serious between therapists and then non-therapists. This idea of like, well, should a therapist struggle with mental health issues? I think it's a really, really good question. Gosh, and maybe that's the better question to ask and to discuss for this. Frankly, there are, in my opinion, good arguments on both sides. As someone going to therapy, you might say, I don't want to work with someone whose mental health isn't good. Like if I'm struggling with anxiety and I go see a professional for anxiety and they're anxious too, is that not the blind leading the blind? That's a fair point. But also if I go see an oncologist, a cancer specialist, and they themselves have cancer, does that mean that they aren't good cancer doctors? So, I don't know, but also with like a fitness industry, if I want to go work on my physique and hire a personal trainer, am I going to hire one who is overweight and not fit? That's an important question. And maybe they know how to be fit, but it's a lot of work and they don't want to. That's fair too. Because that doesn't necessarily correlate with health. Like, you know, someone who wants like a bodybuilder physique doesn't necessarily mean healthy, and sometimes that's actually the opposite, they're unhealthy. Especially competition time. But these are fair questions. Same with the cancer situation with an oncologist. Like, if they have cancer, am I likely to work with them? I don't know that would change my decision. If they were avid smokers, though, like we know that that's only detrimental to health and cancer causing. At the very least, only hurts the cancer process. So maybe I'd be less likely to work with them in that case. It's an interesting question. And on the other end of that, if you say, well, yeah, it makes sense that therapists would have their own mental health issues, because everyone has them. And there's not really a lot of examples for that. That just is what it is, you know. And I think there's probably a bit of a truth in both, which is a very therapist-y question, or answer, I guess. I think one way that I look at it, so grief, for example, which I don't consider a mental illness. I actually think a lot of people coming to therapy are not mentally ill. They're having mental health struggles, and that's not the same thing as being mentally ill. Most people I don't think are mentally ill, generally speaking. I think they just got some stuff that they're dealing with. And that's totally, I mean, people would disagree for sure. In the same way that you might say, well, you know, that person generally isn't ill, but they have the flu right now, so they're feeling ill. It's like, yeah, that's true, I guess. I think I'm speaking more from a DSM classification, which I have it back now, the bigger blue one right there, more up to date. I'm speaking more from that. I think most people that come in don't have what would be called an F code, which is like a main text classification. Some of them would have, a lot of them would have Z codes, or adjustment disorder F code, which I won't get into all of that, I guess, in this space. But point being, most people don't have like a severe diagnosable mental illness when they come into therapy. They just don't. And there's probably pockets and areas where people, that's all they see, especially if you work in agency or community mental health kind of stuff. You're going to see that a lot, I'm sure. Or certain environments, but I think that's just the average everyday person is not constantly dealing with mental illness. And that's why I use grief as an example, because it's very debilitating and painful. But for a healthy grief process, you actually do need to feel it and go through it. So I would actually say there's a higher mental health risk if you don't have grief during a grief-inducing moment, like losing a loved one. Yours might be quick. You might not feel or get super emotional about it to the same degree as the person next to you. But to have an emotional reaction and pain at the death of a loved one is healthy. That's healthy. So that's why I think just because you're not feeling good or you're feeling mournful and you're grieving, that does not mean you're mentally ill. If you're anxious about something, it doesn't mean you're mentally ill. It might just mean you're anxious about something. That's its own category. So, at what point would a therapist be too mentally ill to do therapy? Or, maybe for me, how healthy, so to speak, does a therapist have to be before I would want to work with them or have them be my therapist? A joke that I like to tell people is that I've never seen a group of more mentally unstable people than a group of therapists. It shouldn't be funny, but for me it is. And I don't mean that about people I hang out with. I mean, generally speaking, I think a lot of the therapist community, it's just crazy to me how much of them are just bullies or mean or super disregarding of people. And there's a lot of reasons for that I don't really want to dive into, but I think a lot of therapists are not actually that empathetic people, and a lot of therapists are not very understanding people, and a lot of therapists are not mentally where they need to be. Having worked with a lot of universities and having talked to people at different universities, and it's super clear to me that the standard of becoming a therapist is really low. It's very easy to do. I think actually the biggest barrier to entry is just resources to start, which is its own issue. Assuming you can find the time and the money, you're pretty much just going to be a therapist. Like, there's not really much of a screening process in the field, which is bad. It's a strong objective statement, but I think it's bad. I don't think these universities should have 90% and more acceptance rate and graduation rate. I think people should be declined a lot more. And the acceptance rate is not because they've done a really good job at filtering who's applying. It's because these places just take whoever. It's not that hard to do this job from a, like, once you start the process, you're pretty much gonna be fine. Plenty of people don't make it through, but that's usually because they've decided to go a different direction, or they've done something so horrible that they get expelled or kicked out of a program. But it's pretty rare, from what I have seen, that people, based on their own level of development and maturity and emotional regulation ability, that they're asked to leave because they're not where they need to be. As far as I can tell, as long as you aren't like breaking laws and harassing people, and you're paying the right amount of money, you can just do this job. And I don't like that. I don't like it very much. So, and I will also be clear, there's a lot of therapists that I really, really like. A lot of really good people, and a lot of really smart people, and a lot of very empathetic. This is not supposed to be turning into a bashing my field thing, but it is shocking when you think about the assumed requirements of this field. Like, we're supposed to help people to emotionally regulate, something that many therapists I know cannot do themselves. We're supposed to teach people to be empathetic and understanding, something that many therapists I've interacted with cannot do or choose not to. We're taught to see different perspectives, something that many therapists I interact with do not do. We are told that everyone has value. Actually, we're not really taught that, I don't think. Depending on where you go, there's going to be, or depending on what programs you go, there are going to be opinions on like mixed messages from, accept everyone, but those people are bad. Normal, like, political stuff that universities do. So it's just weird, because if I went to become like an engineer, there's certain standards I would assume, or rather, if I was hiring a plumber, or if I was hiring an electrician or a mechanic, there's certain things that I'm like, I assume that person can take care of their own plumbing, can take care of their own electricity, and can take care of their own car. If they don't know how to do that in their own home, why would I hire them? Now, using those same examples, plumbers still have plumbing issues. Electricians will still have issues with electricity, and mechanics will still have issues with their car. Now, my assumption when hiring them is that they know how to solve this problem better than I do. And when they're at home, that they can solve that problem too, in a way that is better than the average person. Now, should therapists be held to that same standard? It is a different field. It's a mental field. Somewhat creative, but still very research-backed. Generally speaking, we're supposed to be using research and evidence-based practices with our job. We're not really supposed to be coming in winging it and being like, oh, I feel this way, or I think you should do this. It's not what we're supposed to do. And we're clinicians, and depending on your languaging, whether a lot of people say clients, but patients work as well. Like, this is the healthcare field. Some people would say medical field. And so not everyone uses that standard, though. I think this, not like a medical model practice, but like a medical healthcare standard where we're using best practices and we're using evidence and research to help people. A lot of people just go and winging it. And that can be helpful, the same way you can talk to a friend and do the same thing. The difference is someone is paying us to do a trained service. And as I say all this, that should hold me accountable to how I'm performing my work too. And there is a mix of that. Like, you have to be human too. And everyone should, or I would say it behooves everyone to do a good job with the human relationship part of work. Usually things will go better if you can be relationally healthy. But our job is relational. It's face-to-face interactions. It's talking to people. It's working through stuff. It's helping them get to conclusions, not us saying, you need to do this about your life. And that's a difference, too, where we're supposed to be using evidence and research and science to help people get to where they need to be mental health-wise. But there's still a lot of personal choice. And a lot of factors that determine good therapy are, somewhat non-objective. Like empathy building is very high up for like therapy working, as people build empathy. In where they start is part of it. Who they're interacting with is part of it. Some of the work that I do is based around values, identity, meaning systems, beliefs. That's like the definition of something you can't tell someone else about themselves. Now, people I know really well, I can speak into their lives about something and say it and be accurate. But someone coming in with a different worldview than me, I can't just say this is your worldview. And someone who has a different purpose and meaning in their life than I do, I can't really come in and say, no, actually this is your purpose and this is your meaning. I can help kind of navigate and talk, and as I get to know them, I can bring up things and be like, well, you said this, but you said this at a different time, and how does that connect with what you're saying here? In the past you told me this, and now you're behaving differently. What's going on? So as you get to know someone, you can call back to things that have been said, or to their experiences, or things that they've said they want out of their future. So that's where this gets interesting, is you do have to mix this ongoing research and evidence with the real human interactions there. I'm trying to think of a quote. Man, I want to say it's a Carl Jung quote, and I'm going to butcher it because I don't remember it. But it essentially talks about being able to approach a client with like all of the knowledge of someone who has studied and researched this, and with all of the like humanness of someone who loves another person. Like, come in with the knowledge piece, but heart to heart engage as a human, more or less. It's a good quote, and I don't remember it exactly, but I think that's like a fantastic summary of this field. And there are people who do that really well, and there are people who do one of those things really well, and there are people who do neither of them. It's just interesting. And especially nowadays with all the like life coaches that are popping up, there's plenty of people I've seen online proclaim to be life coaches, and I'm like, my first thoughts are like, your life's a mess. What are you talking about? Like, how are you helping? That's just weird to me. And so this is why, like, if I'm struggling with something, what right do I have to speak into someone else's life? And I think that comes down to how that is being managed. Just like if I'm a mechanic and I'm struggling with my engine on my car, that doesn't necessarily mean I can't fix other people's engines. And it doesn't mean I'm not going to be able to fix mine. And so I think that's part of it. If I'm continuously dealing with the same problem and I'm not fixing it, I think that's a yellow flag for therapy. Especially if it's not a diagnosably chronic issue. So someone who's clinically depressed and, exercising doesn't help the same way. It probably will help, but not, fix it, because exercise does get rid of depression for a lot of people. And I'm going to throw the caveat in there, this is not clinical levels of depression generally, but people who are feeling depressed. I think I've talked about this in another video. One of the Nordic countries I think that is recommended before therapy now is exercise, because it is seems to be a lot more backed by evidence that you will benefit more from exercising to treat your depression than you will from going to therapy. So, someone who's depressed, they're exercising well, they're eating well, if they are sleeping well, their relationships are going well, they're making good strides, generally speaking, they feel like they've got goals, they've got purpose, and they're still depressed. It's a clinical level issue. Now, doing everything I just said, their life will be better more than likely for it, but they're still depressed because it's a clinical issue, maybe it's a chemical issue, and they need to potentially look into medication, and hopefully that'll be helpful. That person isn't failing, right? They are learning how to live with depression versus getting rid of depression. And I think that distinction is important. It's something I look at with clients and myself. Like, is this a fix-it problem or a manage-it problem? What are we actually working on? So a therapist who has depression, and they are doing the steps they need to take care of it, and then it goes away, or it doesn't, but they're doing what they need to, that's probably a healthy therapist, even if they're depressed. This is why there are therapists out there who have multiple personalities. There are therapists out there who live with OCD, who are on the spectrum, who have personality disorders. It's because these things don't define your ability or inability to do a job. The difference is, in my belief, how that is affecting your work, and are you doing the things that you are supposed to do as a supposed expert in this field to manage those things and have a livable life. So that same example of that depressed person is going home and they're drinking themselves to sleep every night, and they're going to go and try to treat someone for depression. That's probably unethical, and they probably shouldn't be doing that. But if they're doing all the steps they need to and their depression is better, and they know the signs of if it's getting worse, that predictive thing, right? They might start to feel a little bit more stressed, they might start to feel a little bit more anhedonic towards things than usual, they can see the dip coming, they implement the tools that they need, they maybe even have some steps that they take for when they're in more of a deeper depressive episode that they can implement to help them in their day-to-day. They know the appropriate line for canceling appointments if they need to, and their life is functional in a healthy way while it's dealing with a struggle. Same with someone who's got cancer and is working through that, and they've found a way to make their life functional while dealing with a challenging diagnosis. I think that's a big difference there versus someone who's in complete disarray and in a mess. And if something comes up and now we become a mess and have to deal with it, I don't think that disqualifies you either. It might mean you need to take a break, even just a couple days. Grief's an example. If you fall on grief and you take the week off, doesn't mean you're a bad therapist. But you might not be suitable to sit with people that week. And then you might have to start moving through stuff, or you get a severe stint of depression, or you have a panic attack and you've never had one before. I don't think these are grounds for not practicing anymore. It's what are you going to do after that? And technically speaking, as clinicians, we're supposed to know how to do that, or at the very least, be able to access the information and learn how to do that properly, or be really quick to seek help and do the same work that we would tell our clients to do. That's another common thing, is a lot of therapists, and I'll include myself in this category, will have a habit of giving very helpful guidance and tools and then not using those same tools, which is crazy. Again, speaking at myself too. If I'm telling my clients to get more sleep and then I'm not, assuming I'm lacking, it's like, okay, like we know sleep is helpful. Probably never stop talking about sleep in here. If sleep's helpful, then why would I be on my phone for an hour scrolling and lose that hour of sleep? Doesn't make sense. Now, of course, in the greater context, if you dive into it, it usually does make sense with people. There's like something, that bedtime procrastination, revenge stuff or whatever. I just mix those words up. Where people just get on their phone because they feel like they don't have control over their day. So they scroll to gain back freedom, but they actually steal from tomorrow by doing so. That's definitely, like, you talk about like any evening vice for me, it's too much time on like Instagram or YouTube, so that's dogging at me with that for sure. That's understandable in context. And if doing so causes me to have, from a mental health perspective, more mental struggle the next day, it's not very mature of me to be doing that. And then if it interferes with my ability to work, that's a problem too. And if I do that over and over, and I'm someone who, if I don't get a lot of sleep, I get more stressed and anxious. That is a reaction or a response to lack of sleep for me, which is not good. So if I'm going to be saying I know how to help people treat anxiety, and I'm going to consistently not get good sleep, that's problematic. So generally, if I notice my anxiety or stress go up from where its typical normal is, one of the things I'll do quickly is double check my sleep, which I track on my watch. I don't necessarily check it every day, but if I'm feeling that increased stress, I will check it. And if it is lower than normal, that's solution number one, typically for me. It's like, okay, we're going to bed earlier tonight and tomorrow, and until I see that dip back down, or until I can guarantee that that wasn't the issue. So, and then having a lot of these tools in your belt to handle these issues and being able to teach them to clients and staying up to date on research is really helpful, and not always the easiest thing to do. I mean, there are a lot of people that won't really further their education much after school, and the psych field in general is so new as science and history goes that it changes a lot. I remember when I was in high school, a friend of mine's parent was going back to school, and going back or finishing, I can't remember, but they had a psych course. And the psych textbook that they used in their college course was the same one that we were using in my high school course. They were not similar. It was the exact same book, same edition and everything. So our high school was teaching from the same book that the college was teaching from. And then when I got to college, and when I took that class, we were using an updated book. So that friend's parent was technically behind now if they weren't keeping up on information. That's because in lots of textbooks update, but I just feel like this field is we get new information a lot because it is still untapped for the most part. Just understanding the mind and the brain. And it's cool research as it comes out, but it gets outdated really quick. And not everything. There are some books back here that I have that are older and they withstand time for sure. But when you're just looking at research texts, those are going to update quickly when it's just like mental health research. Like things like treatment planning can stay similar for a long time. A lot of diagnoses stay the same for years, so those books don't need updated all the time. And then adjacent understandings, like we know that sleep is helpful for mental health, that fitness is helpful for mental health, that diet is helpful for mental health, that good relationships are helpful, spirituality is helpful. And a lot of those updates are smaller things. They're not like huge revelations a lot of the time. Like I said before, one of the other countries just recently, maybe within the last year or two, implemented an update that you're supposed to exercise before seeking depression counseling or therapy. That's a big update, but their results were like, look, this is more helpful. People in this group that are doing exercise are showing depression, and similar people showing depression that are doing therapy. The exercise group is healing and reducing depression faster and better than the therapy group. Okay, so go do that instead of coming to see me. That's the whole point of this help people with their mental health. So if that means not going to therapy, great, because it costs money and time. So if you don't need to come do this, don't do that. Go do something better. But if this is the route you need to take, do it. Pick a therapist that is healthy, for the most part, at least. Vet your sources. Call multiple people. Consider multiple options. Talk to people who have gone to therapy. Ideally, people who dealt with something similar to you, because that changes the type of therapy that is going to be helpful. Same with your personality and what you need and who you're looking for. But do the due diligence if you can, especially if your area is, well populated with therapists, like my area is in Kansas City. It's a couple thousand, which is crazy to think there's that many. In like the broad metro, not just Kansas City, but we're talking up to like an hour radius, but if not more. But still, thousands. It's not an exaggeration. At least 3,000. At least. That's a minimum. So there are options, is my point. So people should pick someone who's good for them. Yeah, I do think about this thing a lot, though, this topic of how mentally healthy does an effective therapist need to be? It's a good question. And kind of a scary one, because if I come to a conclusion and I don't fit that category anymore, I have to make some changes real fast. And I've had to a couple times. I mean, I'm saying that like it's a scary possibility, but it totally happens. I think that's an important part for a lot of people. If you're messing up or not meeting a standard, if you have the ability to change that overnight, then just change it overnight and don't worry about it. You don't have to quit your job or just fix the problem. Take care of it and move on. But if it's going to be a lot, I mean, some therapists have to stop to go to rehab, or they have to stop or even just cut their caseload in half and lose out on the income, and that's hard, but they might need it. Sometimes we do have to do extreme things to help with that. And that's okay. That's better in the long run, even if it sucks now. So, yeah. This was cool because it was not the direction I wanted to go, and I have a lot more fun doing this when I don't really know what's going to happen. It makes it super fun. Yeah, that's what I got. That's today.